Your face is your health dashboard, and if you have sudden changes in your complexion, your skin texture, or even your features, this could indicate that your body is struggling. It could be anything from food allergies to hormonal imbalance, all the way to something major like liver dysfunction. So in this video, I'm going to share with you what your face tells you about your health. But before we get started, I'm Dr. Nick Zyrowski, and it's awesome hanging out with you in this video. The first indicator that we're going to look at today that your face is telling you there's an issue in your body is if you have dark circles under your eyes. Well, if you have dark circles under your eyes and you're me, well, that's because I have a lot of small kids at home and we don't get the best sleep at all times. So the first thing that we have to look at is sleep and also stress. And a lot of times those are paired together. So if you're noticing this is a chronic issue for you, then definitely work on your quality of sleep. And you'll want to put some more effort into making sure that your stress is reduced, especially around nighttime, and that your quality of sleep is going up. Now, this also could indicate on a more serious note that you have either sluggish kidneys or a sluggish liver. And this is basically meaning that we really want to put some emphasis on maybe a liver detox or a kidney detox and really focus on these organ systems. Now let's move on to a puffy face or puffy eyelids. What in the world would this mean? Well, if you notice when you look in the mirror in the morning that your face is all puffy, this could be a result of a thyroid issue, mostly associated with hypothyroidism. Now, there is something also called moon face. And moon face is when you have high amounts of cortisol for a long period of time and, well, your face starts to look like a moon. It starts to look very puffy and rounded. This is typically going to be due to chronic stress or an adrenal issue. So if you notice that your face becomes very rounded, we want to start thinking about how can we get that cortisol under control. And I've seen this before clinically. It's like there was a young lady who she was exercising. She was doing all the right things for her health, and yet she could notice that her face was becoming more rounded, and this was due to high cortisol levels. So anyway, got the cortisol under control and things turned out to be just fine. Now, this is a problem that many of you face, and this is an interesting problem that everybody's trying to find solutions to, and this is acne. Now, if you notice that you have a bunch of acne and it's not going away, here's what you want to look to. First, food sensitivities, and the two most common food sensitivities that you will face are going to be either dairy or wheat, okay? Now, the dairy one, it's obvious. Start cutting out dairy. Do it for about 2 to 3 weeks. See if your face starts to clear up. Now, if it's wheat, many people will go, well, I don't have celiac disease, so I couldn't potentially have a problem with wheat. Well, it's estimated that about 90% of people who don't have a problem with celiac disease are still gluten sensitive. And if this is the case, it could cause some problems for you. So we want to make sure we're cleaning that up. Now, another area that you have to look to that nobody ever does is your gut. When you have poor skin health, you always have to look to the gut. You could have bacterial imbalances, you could have some sort of yeast overgrowth, you could have intestinal permeability. And I will tell you, the quickest way to start improving your gut health is by taking a probiotic. I see this clinically all the time. It's like I get somebody on a probiotic, the acne goes away, then they come off of it because they think they're fine and the acne comes back. And I will share with you in the description below to a probiotic. It's called Probiotic Strength that I find to be the best working probiotic for acne. And I can tell you this because clinically we use a lot of different probiotics, and this one in particular for some reason works incredibly well for those who are suffering with acne. So I'll put a link in the description below to this particular probiotic. Now let's look at red cheeks or a red nose. What would this mean if we're walking around with bright red cheeks? Well, this would be an indication of rosacea. All right, but now that we have that fancy name, still, what does it mean? It means that we are having a reaction to potentially gluten. You can get a gluten rash. Remember, 90% of people who don't have celiac disease still are sensitive to gluten. You could get a gluten rash. You could be having an autoimmune response due to maybe something you ate. Or you potentially could have high blood pressure or just systemic inflammation. So this really goes back to some of the main conversations we talked about. Watch what you're eating, and also make sure that if you are sensitive to a food, you're making changes. And if you are someone who is suffering from an autoimmune condition and some poor gut health, which remember, 80% of your immune system is located in your gut, you're working to make some changes, and probiotics are still great for that. Now let's talk about cracked lips or even potentially sore sores on the edges of your mouth. What would this indicate? This is a B vitamin problem in most cases, typically B2 or B12. Now, if you're somebody who's suffering from this and you are taking B12 already because you've heard this and it's still occurring, here's what you need to do. There is a good chance that you are not absorbing the B12 that you're taking because your digestive system isn't able to break it down. Without getting into the details of it, here's how you fix it. You start taking a B12 that you slip under your tongue and you rely on the mucous membranes in your mouth to absorb this B12 versus relying on your gut to absorb the B12. And this typically will solve your issues. And I will of course put links in the description below to anything that I mentioned in this video. Let's talk about another issue that could happen. And this one's actually a little bit scarier. This is going to be a yellow tint to the skin on your face or your eyes. Let me tell you an interesting story real quick. When I was in college, I walked into class one day and I saw one of my friends in the room and I sat down in front of him in the desk. And as soon as I sat down, I turned around and I looked at him. And as soon as I looked at him, I noticed right away he was yellow and his eyes were yellow. And I said to him, you're very yellow today. Has anybody told you that? And he's like, yeah, people keep saying that. Well, what was it? Well, this is what it is. It's a problem with your liver or your gallbladder. And this is called jaundice. You've heard of babies having this before. So therefore, this individual, my friend, he had jaundice. He ended up in the hospital for about 4 days. Fortunately, everything was fine. He cleared up. They solved these issues for him. But certainly, if you notice yellowing in your skin, you want to head off to the doctor's office and get that looked at right away. The next big issue that you may be facing is dry, flaky skin or even a dull complexion in your face. Well, what could this mean? This could be as simple as dehydration. This could be as complex as a thyroid issue, or it could just be to, you know what, your skin's very dry and you need to maybe put something on it, all right? And one of the things that happens so often is when your skin is dry or when you're having skin issues, you start to use a lot of chemically based lotions that aren't nourishing for your skin. You want to make sure that if you're putting something on your skin in order to help with the dry skin, it's something that is very nourishing, that has some of the same vitamins and nutrients that your skin needs in order to be healthy. What I would use in this case is tallow lotion. It works incredibly well. Dry skin, cracked skin, dry nails, cracked nails, you put tallow lotion on it and it works so good. And I'll put a resource to the tallow lotion that I typically recommend to people because it's actually infused with olive oil and has tons of good nutrients for your skin beyond the tallow. Now let's look at something that's a little bit more unusual, but still could happen. If you ever wake up one day and you notice you have facial asymmetry, like you have drooping on one side of your face, well, here's what this could indicate. This could indicate neurological issues. This could indicate a condition called Bell's palsy, or it could even indicate something very serious like a stroke. So if you ever wake up and you notice that you see drooping on a part of your face, you want to actually go to your doctors and get this checked out immediately. Now, if you are a woman, this is for the ladies out there. This one's important because this happens to a lot of women and they don't know what to do about it. If you notice that you are getting really bad cystic acne on your face, and you notice that you are getting hair growth on your face that is excessive, here's what you have to be aware of. This is typically a hormonal imbalance, a lot of times associated with something called polycystic ovarian syndrome, PCOS. So if you are having this issue, it means you're androgen dominant. This means that you have too much testosterone in your body. And this is where you really want to get some hormonal work done. It's very important. And especially if you're getting that cystic acne, it's a very common sign of too much testosterone in the body, and it's really going to wreck your skin if you don't get it under control. So you definitely want to do that as soon as possible. So I gave you a lot of tips today on how you improve the quality of your skin and your appearances. I gave you a lot of different tools and methods, which I'm going to put in the description below. This stuff all really matters because you know what? If you look good and your skin looks really healthy, you look youthful, it has a huge anti-aging benefit to it, and who doesn't want that? So I hope you enjoyed this video and you got a lot out of it. If you enjoyed this video, I know you'll really love this one next.